could not help but lock eyes with her. And I said, I bet you never thought I'd be doing this. And we let them stay in the room to witness the delivery.
How many people were in there?
20.
20? Hey guys, welcome to Nurse Talk. My name is Mia, and today I have a very, very special guest, my mom, Michelle.
Hi, everybody.
Thank you so much for coming. I'm super excited.
I am super excited. Can I just say this is so surreal?
Aww. So you didn't become a nurse until you were in your 30s. What did you do beforehand?
My background is generally in banking, and then just prior to going to nursing school, I was a quality assurance specialist for Capital One.
Did you enjoy that?
That was the best job I ever had. And I honestly, literally, it was a corporate job, and I think it really prepared me for the professional side of nursing.
Awesome. So what made you want to switch to become a nurse?
Banking arena was a little fickle back then, and they were outsourcing people everywhere. And I remember leaving Capital One and starting to apply for a different job at another bank, and then you walked in the office, and you were all of maybe 8 years old.
Mm-hmm.
And I remember looking at you in that moment and thinking, what am I doing? I need to pursue something that matters, something that will make a difference, and something that is sustainable, and that I know that I'm going to have a job to be able to support my family.
Aww. Going to nursing school in your 30s with a family, was that hard?
It was hard and it was easy. And let me delineate those two. It was difficult because I always had to worry about childcare, specifically with your brother, because he's much younger than you. But I had such support. Grammy and Grandpa were always there to pick it up if I have to go in for an extra lab or things like that. So I also had the ability to go to school and not work because my husband was able to provide at that time. So nursing school was hard, and I pushed myself. I wanted to be the class president, and I wanted to get perfect scores. All of that was so important because you guys were at home waiting for me.
Aww.
So it was both.
Yeah.
I love school, though. I loved it. I could not get enough information. And I'm a dork, so I always sit in the front row.
I didn't get that gene. Brother did,
No?
but I didn't.
Brother did.
I like to sit in the front row, but I can't get enough with school is not a thing for me.
I would be a professional student for life if I could.
If only it was free in America.
It would definitely benefit our country.
Mm-hmm. Absolutely. So you knew like straight into nursing school that you wanted to do L&D, right?
Absolutely.
What drew you to L&D?
When I had my children, you and your brother, I did not know anything about the human body. I don't know what I was doing in biology class. I have no idea. But when I became pregnant, I wanted to ensure that I did everything possible to create perfect, healthy babies. And so they had this book out that everybody was reading, What to Expect When You're Expecting. And I was so amazed at what my body could do. I wanted to pursue that further. And I was also still in my child creation days. So I was considering another baby. That didn't happen. But I knew it would be something I loved. And what an honor to be there when someone gets a whole new member of their family. It was really cool.
Yeah. I mean, I've only seen maybe a handful of births, and I cried at every single one of them because it's just so cool.
It was amazing. I remember I had a most excellent preceptor, and that is so very important. And in the first delivery, when that baby came out, I couldn't help it. I cried. And she turned to tell me something, and she saw it. She's like, oh, girl, just enjoy it.
Aw.
And so I did. I just stayed in the moment with that family, and that sealed it. I was not going anywhere else.
In your early days of becoming an L&D nurse, what were the most challenging aspects for you?
Okay, so I started at a hospital that is basically the front lines in a war. I mean, it was so busy constantly. So you had to really keep up. I mean, you were on your feet running all the time. I mentioned my preceptor before, Ronnie Huber. She was so calm in every situation. And I gathered a lot from her because doctors, surgeons in particular, can be very demanding. And all of those doctors had specific rules on exactly how they wanted their paperwork, where they would like it placed. And there were so many, and it was hard to get to know them, especially being a brand new nurse, and they knew it. So I think perception is reality most of the time. And I just kept my nose to the stone and worked and did my best. And it didn't take long to win them over.
You feel like they were kind of mean in a way of trying to like maybe...
There was one nurse practitioner who was notorious for being a little crabby. Most of the doctors I went over very quickly. And she was a hard one, but she ended up loving me. And
Oh, that's good.
she cared a lot about her patients. I understood how she was so by the book and demanding and quick, quick, quick. But that's the way that I like to work. I like to keep busy and keep moving. And so she fit my style.
Do you remember your first L&D solo shift and maybe the first baby that you delivered?
Yes. Okay. So the first baby, I was under my preceptor. So that wasn't so stressful. But the very first solo shift, I had just come off of training, and they gave me 2 active labor patients, which generally, when you first start on your first solo thing, you get 1. But the charge nurse at the time said, sink or swim. And that was it. So I went swimming. And I had 2 labor patients. Both were fetal demises. My one was at 40 weeks.
Oh my God.
And the baby had been absolutely perfect the day before for her prenatal checkup. So this was a shock to her, to the family, to the doctors, to everyone. And she had to go through regular labor and deliver that baby, even though it was a total loss. And that was so hard.
Yeah.
And I remember ending the shift. I kept my shit together during the day. But as soon as I got in the car, I dialed that phone and I called Grammy up and I said, what up? And she talked me through it. She said, you know, Shelly, nursing is stressful. You're going to have these days. It's okay. And I was working kind of far away. So I got about 45 minutes of, mama therapy and the ability to calm down before I got home. And I knew that the next day is not going to be the same. And so I just went to bed and got up and did it the next day. And it was a beautiful day. And my outcomes were perfect. And I was fine after that. But it was quite a first solo shift.
Why do you feel like the charge nurse decided to do that to you on your first day?
I'm not sure. I feel like I got there when I was at the very end of nursing school, that 3-week period where you get to pick whatever department that you want to do your clinical hours in. And I went straight to labor and delivery, of course, and I told everybody there, I want to work here. I want to work here. I want to work here. And so I did everything I could. I worked my ass off. And I think part of it was, let's see what she can do. But the other part of it was, I know she can do it.
Okay, I want to know about some of your interesting L&D stories. I've heard a few of them over the years, but...
Okay, so one of my favorite L&D stories, and I don't know if I should tell it, but I'm gonna. There was a female doctor, and she was probably about the same age as I was, and I just loved her. We had a really good rapport, and she had a patient in one of the rooms, and there is always a visitor's number, a limit that you should have in the room. But their family was so large and so kind and so well behaved that because it was after hours, I looked at her and she looked at me and we said, we're not kicking anybody out of this room for the delivery. So they promised that they would all stand in a group on the one side of the room and stay clear of anything that we needed to do. And we let them stay in the room to witness the delivery. And it was the most beautiful moment.
How many people were in there?
Like 20.
20?
And
That's
I
a lot
probably
of
could have
people.
gotten in big trouble if people had found that out, but there was no incidents. I mean, we had a very specific and clear conversation with the family before we allowed that to happen. And they were all bona fide family members. So it was just one of those in the moments, we're going to make that decision. And I would not take it back.
I love that. I don't know if I would be cool on like me being the patient delivering with 20 people staring, even if it is my family, that is a little odd. But I can see how that would be honestly really amazing.
It was the most beautiful delivery ever.
Aww.
Yeah.
Okay, so do you want to share the story about how you delivered your classmate's baby?
Oh, yeah. I actually delivered 2 of my classmates, which was surreal then too. But I remember when one of my girls came in and she was 6 centimeters. And she was the female doctor's patient. And so it was a happy vibe, from the start. And she came in and I was so concerned because this was her first baby and she was already 6 centimeters. And I didn't know exactly how fast it was going to take. So she saw that I was jetting. I was moving. Pop in the IV. Get your stuff in. Da-da-da. And she looked at me. She said, Michelle, I've been at 6 centimeters for 3 or 4 weeks. Like, you can slow down. And I just turned around and looked at her and just laughed. And I said, oh, okay. We augmented her labor with Pitocin. And I went to check her cervix. And that was the funniest part because it was just regular status quo. And then once I got in there, I could not help but lock eyes with her. And we looked at each other and laughed. And I said, I bet you never thought I'd be doing this. And it was just one of those funny moments. And then I stayed late. I didn't want to not be there when the night shift came on. So our boss was so very generous in those times to allow us to do things like that. So I stayed through it, and the baby had some details and and we're like, get this baby out, push, because we didn't want it to end up, in a C-section. If she can get that baby out, and it was great. The baby was perfectly healthy, and it was a fun time, like the whole time, even during the stressful times. And because she's also a fellow nurse, so she understood what I was doing, but I never stopped explaining what I was doing because that wasn't her specialty. I know it's a caveat to a different point, but people are specialized in different things. So always make sure you're telling them, because some people feel like they should know, and it's impossible to know everything.
Yeah, I've had people in the NICU try to hide that they're a nurse because they don't want people to expect them to know things, especially when the babies are completely different. I mean, obviously it's a human being, but everything's different.
Yes.
So I've had people try to hide that they're a nurse, and I think it's just so they're like, oh, I don't want them to expect me to know everything. Right. But it is true. Just because you're a nurse doesn't mean that you can keep up in any situation. You know, if you go to a specialty, it could take you 6 months to a year to even feel comfortable in that specialty. So just to assume that someone who went to nursing school knows everything. Please don't explain everything.
Yes, that is so very true. And the best experiences that I've had are the nurses who come and say, or I'll notice maybe in their chart that they're a nurse, and I'll say, oh, I see you work in CVICU or something like that. And I'll say, I don't know anything about that. And that's an invitation for them to say, I don't know nothing about babies. And then that's an open communication the entire time.
Yeah, it's you learn things very briefly to take a test.
True.
In nursing school. And especially when you're a hands-on learner and you just never apply that, you learned that 10 years ago over a 3-week course, you're not going to remember that.
I think one of the most important things that my preceptor told me when I started nursing school is that it is impossible to retain all of the information. As long as you know how to access it, you'll have your information.
Oh, 100%. Yeah, even till this day, I'm like, I feel like I should go back and relearn X, Y, and Z, because it's so hard to remember everything, especially when you're in this stressful time of nursing school. I don't know about you, but I guess you kind of explained it, like you kind of had a decent time in nursing school, but most of us did not.
Oh, I'm not saying it wasn't tough. Yeah. It was hard.
No, but honestly, nursing school was like the worst part of my life because it was just, I also did an accelerated program. During COVID, while working and making no money, like, you know, really struggling. So I feel like I didn't retain a lot of it because I was in such a stressful time.
Just be mindful of where you can locate your policies and procedures specific to your organization. Mm-hmm. As long as you know where to find it, you will have the correct answer.
Yeah, honestly, I have a little binder that they gave me during orientation. And even a couple months ago, I was like, okay, I need to kind of re-up on procedure for this and this and this because they're so particular. So anyway, I printed them out and now I have this binder and I'm like, okay, if I have any questions, I can just refer to this. And I like organized it and it's just, I take it with me now every day because it just makes you feel so much more comfortable. It's like the information is literally right there. So I would recommend that if you feel like you have a hard time remembering.
I have a pretty good memory.
Yeah.
But it's always nice to have a second glance if you need one. Mm-hmm. Just as long as you remember to update your policies if they switch that page out.
Oh, I know. Luckily, policies usually get updated like every 3 years. So like,
oh yeah, it doesn't happen that often.
I wonder how often they do. I think it's every 3 years, but it could be like 5-10 years, depending on what it is.
I don't know. And it depends on where it's coming from too. Is it coming from risk management or is it coming from a protocol issue from the department? I mean, you just have to keep up with your emails, which is hard to do all the time when you hit the floor and start working and don't stop until you leave. And you get 100 emails a day.
Yeah, I'm very particular, but I have 4 emails, work being one of them. I check them like 4 times a day.
Oh my gosh.
And I clear them. Good. No, it's just kind of OCD thing. And I clear them. I go through all the work ones because you can miss something really important with work. Absolutely. Where it's like, yeah, I'm like, I don't want to miss anything. Especially because like I'm part-time and I feel like sometimes I'm a little vocal, and I don't know if my manager actually likes me or not. So I'm like, let me not hand seal deliver a reason to get rid of me. Here
That's
you
hilarious.
go.
Yeah.
So
No
I'm
kidding.
like, no, literally. So I'm like, While working in L&D, did you observe any like cultural differences with your patients and their families?
Of course, there's a lot of differences between people depending on their culture. And I think that's a beautiful thing. There are certain aspects of some cultures, they're going to be a little more demanding, or they're going to need a little more coddling, or they don't need you at all. Depending on where they're from, their beliefs, all of that ties in. So it's been very interesting. I've been able to see some beautiful things, especially with like Indian families. They require a little more care, but it's like they incorporate you into their family too. They'll share their food with you or tea. It's just things like that really impressed me as general humanity type of things. There's also populations where they're very stoic and they won't show that they're in pain. Things like that. And you have to be aware of that because they're not going to ask for anything. So I was made a point to double question sometimes. Are you sure you're okay? I notice you're guarding. I see that you're wincing. You're walking very slow. Are you in a lot of pain? No, I'm fine. Are you sure? Okay, I'm in pain. Like, there's no need for that. Let me help you. So, yeah, there's differences everywhere.
Okay, so you had a pretty life-changing event that took you out of work for like 10 years almost, I think. And after that, you came back to work, which was so scary, I remember, because a lot changes in a decade. But you went straight to mom and baby, which I think I would go berserk. Like having to learn all of that new stuff and then having 8 patients. What drew you to mom and baby versus going back to L&D?
To be completely honest with you, when I initially interviewed, I interviewed for labor and delivery. They didn't take me because I have a shoulder that doesn't work properly. So I wasn't able to push a gurney by myself or transfer a post-section person alone. So they declined me for the position and I was fine with that. But then I got a call right back and said, it's a pass for L&D, but we'd really be interested in you pursuing mother baby. And I thought about it for a second. And of course, when you do labor and delivery, you do mom baby. If there's not an active labor and there are lots of mom baby patients, that's your assignment for the day. So I was quasi familiar because I didn't do it that often, but I had enough sense to know, I thought, what that position was going to be like. So that's why I went to mom baby.
How would you say your overall experience on mom and baby was in comparison to L&D?
Okay, so the most striking differences. I had been out of work for such a long time, and I had been home by myself for a long time. So I came back to a also extremely busy unit, and I hadn't really been used to interacting for such long periods of time and focusing so strongly for 12, 13 hours constantly and then going home. So initially, that part was exhausting. And also the fact that I didn't get a proper orientation to that hospital or department because it was COVID time. And so everything was done from home. And then I just popped in on the scene and I didn't know anyone. And I was kind of nervous. So a little quieter than I normally would be. And that was very, close-knit unit of fabulous ladies, all ladies, which sometimes can be a little too much estrogen in the air, So I think initially it was hard because they're like, who is this person? Where did she come from? What was she doing? And I remember having to ask a couple times, can you show me the best way to do this? And I think they were missing the part where I'm also relearning my body mechanics, not just new policies and procedures. And so I think there might have been one or two comments that I overheard. I thought she did this before. Why is she asking that? And I had to just ignore that and push through. But I'm glad I did because it was also an amazing position to have. I think they put a lot of strain on you as far as the number of patients that you have. When you have mom baby, I don't think people realize the mom has one doctor, the baby has a totally different doctor. And now you've got 4 rooms, that's 8 patients. And even though you do your assessments all together in one room, that's still 8 head to toes. That's still reviewing all of their health history, their meds, or all that stuff. So there was a lot to do.
I can't even imagine because I've heard about mom and baby, and it's like you have to discharge 2 patients, and then the second you discharge, you get like 2 more, and then your other couplet discharges later on in the day, and then you get 2 more, and I'm like, I wouldn't be able to keep track. Like, what's their last name again?
It's an amazing balancing act that, initially I was like, how on earth do people get through this? And then you kind of just make yourself a pattern, and then you just learn to go with the ebb and flow. But there are significant times during the day, and as long as you can get your first row of patients seen, assessed, medicated, all done and charted, and I would try to do that by noon. And as long as that was going well, I knew that I could handle it as part of the day, and discharges are just an extra, And they did try to put a little bit of time in between you discharging someone and then getting a new admission. But as busy as we were, that didn't always happen.
In the NICU, we could discharge, and then they're like, oh, we need you to take another one. And you're like, and they're kind of extensive.
Yes.
And at least in the NICU, it's very like, especially if it's complex or they have a G-tube or anything like that. It's like, or if they're Spanish speaking only and you have to use a translator or whatever it is, like you could be in there for two hours easy.
That was another thing. I was not used to the electronics element, all of the updates that had occurred when I got there, especially like the language translator machines and all of that stuff. We hadn't done that before. There was always a phone call and someone talking, and now you have this other piece of equipment besides your computer on wheels. Now you got to pull that other thing in there. And it does take longer to admit and discharge someone if you have to run everything through a third-party translator now.
Oh, yeah, of course.
Yeah. So, that was a lot.
If you could pick L&D or mom and baby after working in both, which one would you pick?
I would absolutely pick labor and delivery.
Okay.
I just have no way of getting over that first moment, those first breaths, those amazing family members. And mom baby, I really loved for the social aspect of it.
Yeah.
And being able to teach and help a family. Labor and delivery is a little more technical. You get to titrate medications. There's stuff going on constantly. And that's the way that I like to work. So it fit me better, I think.
It's a little bit more critical, and then you have like 1 or 2 patients rather than like not so critical patients. Yeah.
Yeah, especially with my personality and just the way that I think, having those one-on-one or one-on-two, patient ratios was particularly special.
Just knowing you as a mom, I would definitely have you as my labor and delivery nurse.
Aww.
So let's get into the good stuff, the mom and baby stories.
It was a situation that, everybody's working hard and nobody's paying attention. And all of a sudden you hear a commotion coming from down the hallway. And everybody stopped to listen, but it wasn't really making a lot of sense. And I would make the sound, but I don't want to seem like I'm mimicking anybody. But it was not another language. It was just a sound. And so, but we knew it was stressful and urgent. And so half of the nursing desk leaves and runs down the hallway while we see the patients come out of the room. It's the mom and the dad, and they're both hearing impaired. So when they were articulating, it wasn't sounding like a regular conversation. So that's what brought the attention. But the fact that they were throwing things and she ran out in the hall naked and he was running down the hall. He had a backpack on, and my charge nurse at the time, she came and straightened that situation out because that was the type of charge nurse that she was. And she ended up pushing his ass out the door, but she literally threw her baby at another one of my nursing friends during this time because he was breaking her phone. It turned out to be a jealousy issue. And so the police were called. And even though the commotion and stuff had calmed down, when the police officers came into the unit, remember, all estrogen, there was one particularly tall, fine-looking police officer and a lady officer. And I just sat back and watched every head. There's like 20 nurses on shift at this time. Everybody's head just moved and followed down the hall. And I remember just laughing like, guys. And they're like, wow, what a handsome dude. I'm like, yeah, we rarely see men here except for the dads. It was a very interesting day.
That sounds like fun.
It was humorous at times, and it was critical.
Of course.
Times, especially for her because,
Yeah. Everyone thinks I'm crazy where I work because I love being floated to pediatric med surg.
Oh my God, I can't think of anything worse.
And the reason I liked it is because of the parents. Everyone was a lot more wild on PD med surg. PD med surg than just the NICU. The NICU it's very structured and, it's just different. So I would always say, if people are floating, I'll go. Even if it's not my turn to float, I'll go there because I find it really interesting and it's different than you've been in NICU and you didn't like it, but very structured, so you're kind of just flowing with the wind there, like trying to just get everything done. And I remember one time I walked into the room and I just introduced myself. It's like 7:30 and I'm like, hey, I'm going to be your baby's nurse, whatever. The baby was like a year old. They usually try to give us 2 years and below, just because
that's what you're oriented
if
to.
we're a baby nurse, we're not going to know what to do with a 17-year-old. So anyway, and it was so funny because I knew I had already said it to someone the day before. I'm like, oh, I'm going to sign up to go there because it's just so interesting. The parents are just wild. And so I walk in, it's 7:30 and I'm like, hey, whatever, just introducing myself. And within 20 minutes, I knew their entire family story about how he has 4 kids with another woman, and then they were all friends, and then they started sleeping together. And then her ex-husband, who found out they were sleeping together, called his girlfriend while they were cheating, and that girlfriend showed up to the hospital that night. So the charge nurses were talking about it. It was like this whole thing, and then the 2-year-old or 1-year-old, however old she was like the 7th child among the two of them. And they had only been dating or seeing each other for like a month and a half.
What?
And yeah, no. And anyway, they were telling me how they're trying for another baby.
Stop it.
And all of this by like 7:45. Anyway, I was like, this is crazy, and I love it. The one other time I went to PD, it's not private rooms like the NICU.
Right.
So in this particular room, there was 4 patients.
Oh, wow.
And so the moms next to each other were getting so angry at each other for being loud that in the middle of the hallway, they start arguing and screaming at each other. They pass me the baby. I'm holding this baby like, it's okay, it's okay. And everyone's looking at me like, oh my God, are you okay? Like, our float is like in the middle of like, F you, you loud, like Dala. And I'm like, I'm just having a good time.
Hey man, you're watching a Jerry Springer episode. Have a good time.
I like that show. It's interesting.
Yeah, me too.
So, I'm just bouncing around this baby, like, trying to talk to it so it doesn't hear like what their parents are doing. Or not the parents, but, the moms. And security was called, and it was right in front of the nursing desk. And I was just like, I love it here. It's interesting.
I like those crazy days. Those are interesting.
Do you have any other mom and baby stories you'd like to share? Didn't like 2 baby mamas deliver on the same floor?
I was not the nurse for either one of these patients, thank goodness. I was just kind of a backseat spectator. But this full-term mom came in and delivered her baby and came up to the unit. And the dad came to visit. And then not shortly after came another lady, full term, to deliver her baby. And daddy came to see daddy. He's literally having 2 babies with 2 different women at the same time. And that was not a low stress situation at all. I wish I had been a little more nosy at the time, so I could have gotten a little more of the deets on that one. But you see interesting things like that a lot, unfortunately.
Do you think that the 2 moms knew about each other?
They absolutely did.
I find that interesting.
Yeah. He had to leave a couple times.
Wow.
So I don't know if it's actually a story or just like a matter of the times, situational kind of thing, but I was not prepared for the prevalence and just overt use of marijuana and vapes, whether they ran out to their car or came and made a smoky room, even though you're not allowed to smoke in there. It was almost as if every other patient's daddy was in the elevator, smoking it up. So I don't even know how I feel about that, but I was surprised at the fact that they never stepped in or prevented it, or if they suspected someone's usage, they would neglect not to search their bag or anything like that. I would think that they would try to do a more preventive approach to that type of thing, but I think they're just kind of going with the flow.
Yeah. People do wild things in the hospital. You would think that they wouldn't.
They do. And I can tell you stories from, like, my coworkers have stories where they've walked in on all sorts of activities going on in the room.
Like what?
And like a fellatio, let's say.
Oh, wow.
Happening in the hospital room. Like, you can't even wait till you get home. Things like that. You be amazed at what you see in the hospital.
I saw some of that on the adult unit.
Yeah, I bet you did.
Where it's like, Why is there a chair in front of the door?
Yeah. Why'd they
For
lock the
safety
door?
reasons, we need to be able to get into your room, sir. Or when they both go in the bathroom and turn the shower on and you're like,
You know they're smoking or doing something else.
either one, you're doing something bad.
Yeah.
Yeah. Or when they're laying in the same bed and then you walk in because it's 3 a.m. trying to be quiet. Just verify that everything's fine. And then they're both pop up like, yeah. Yeah, I've seen all that stuff too. It's
crazy, isn't it?
It's kind of gross.
Do that at home.
So if it isn't apparent, I am a NICU nurse. But my mom has been floated to the NICU quite a few times. And I just wanted to hear your opinion and if you liked the NICU at all.
Okay, so I hated the NICU. Not the people, not the parents, not the babies. I don't like to be confined in a space, and I hate to sit down when I'm working. And I know that a lot of people find that as a benefit to being in the NICU, but I have a hard time staying still. And I wasn't familiar. Like I was so new to NICU. I had never done that before. And even though they're supposed to give you feeder growers, that's not always what you get.
Yeah.
And as long as I felt confident, I was going to accept the assignment. And so there was a little bit of nerves there. And my babies had a tendency to pull out their NG tubes. And then I'd have to go find somebody to insert it. And I hated depending on somebody else to do something, but I was not going to do something I wasn't familiar with, especially on a preemie. I mean, on anyone, actually. Yeah. So it just wasn't for me. All the alarms going on all the time, constantly. I couldn't tell you if it was coming from that room, that room, that room, or that room. I was just stuck in one spot and overstimulated.
Yeah, and when you have to feed, especially because you only get grower feeders for the most part, having to bottle feed 3 babies.
Which I didn't mind because
But you have to sit still for the 30 minutes.
You do. And that's what was killing me. Plus my shoulder, and this is the way I feed. So, but I understood the importance of not just popping that formula and NG tubing it in there.
Yeah.
These children need to learn how to eat, and they need to gain weight, and they need to grow big and strong. So I would take that time no matter what was happening.
It's one of my favorite things, but every once in a while it can be kind of torturous because you're there and you have 3 of them and they all take the 30 minutes.
And they take a long time. And
so
you
you're literally
pace those little babies.
Yeah, and you literally have to stare at them. You can't look away because they can choke.
Yeah.
So you have to sit there for like 6 hours of your shift, literally like still like just watching a baby eat, and
you're thinking, oh gosh, I have to give this med over there, and oh no, I haven't
Mom
charted
is calling
yet.
in that room.
They're rounding now.
My day yesterday.
Yeah,
with 4. Anyway,
and I felt kind of on the spot because they would round every morning with respiratory therapy, with the neonatologist, with like everybody would come. And then you stand there and you give a report on your babies. And sometimes when people are floating, they don't have the best report to give you because they weren't familiar either.
Yeah.
And so you're standing there and now all these people are staring at you and you're supposed to know X, Y, Z, Z. And then know to have the number and call the parents, and then the doctor talks to them right then and there.
Ew, I don't like that. We don't have to do any of that.
Yeah, it was set up like that. And if it had been a normal department that I always worked in, I mean, that would have been routine. But for me, it was absolutely not routine.
In my unit, we, the neonatologist or the resident, whoever is assigned to that baby for the day, gives report on the baby, talks about everything. You listen in, and then at the end they say, do you have any concerns?
That is most excellent.
And then I'll say, oh, he's got a rash here, or he's desatting, or whatever it may be. And they say okay, and then they'll make changes here and there if need be, but most of the time it's no, the baby's doing good, he's still just working on his feeds or whatever, just depending on the acuity of the baby, of course. Other things are way more in depth. Like if you get a baby on a bunch of drips and stuff, the report can be like 10 minutes where you guys are trying to find a happy medium for the baby.
Right.
But generally with the grower feeders and stuff, it's like, yeah, you just stand there, no concerns, okay. And then the doctor is in charge of calling the parents every time.
See, that would have been so much more gentle. I would have loved that approach rather than the other way around.
Yeah, because that takes a lot of pressure off of you. I feel like the doctor should absolutely give report. So looking ahead, what type of nursing do you plan to focus on?
I have a fascination with the law. I don't know where it came from, but it's fascinating to me. So there is a certification program out there for a legal nurse consultant. And it is a little more schooling, but you know I love school. So I was considering getting that certification and just doing a little pivot.
So would you want to focus more on the nursing side to even maybe do work towards nursing and passing laws for those types of things? Or would you like to work on like cases for attorneys for, personal injury? Like what kind of interests do you have? Or are you kind of open to anything?
I am open to all of that. I think initially it would be intelligent to get your feet wet and maybe work for a law firm, review cases, be an advocate for the patient in whatever capacity that you do. That's your learning material. And I always like to have a strong foundation as far as passing laws, legislation, interesting things like that. Absolutely, I would love to do that. Anything to improve anybody's situation, I would love to be a part of. And I would do that armed with absolute understanding.
If you could pass one law for nurses, what would it be?
Lower acuity, lower patient load, higher pay.
Mine would be that just like if you put your hands on a police officer or any other pedestrian, it is illegal to put your hands, battery, whatever you want to call it, onto anyone, especially a nurse.
That is a really good point, and I don't think my mind goes there because I was so sheltered in labor and delivery. I don't really see that a lot. They teach you in nursing school, never let the patient get between you and the door and things like that. So I can definitely see what you're talking about, but you're talking about like in a punitive way, or
if your diagnosis isn't psychosis or something, related
Alzheimer's.
to, something where you're mentally unwell and you can't prove that, if you put your hands on a nurse, you should be charged 100%. And they're not.
Where do you draw the line though? Because it's hard when you have complete access to someone's body and they are unsure or scared or in pain and they reach out and grab you. Where do you draw the line?
I think the line should be I don't think that's the line, because I've even done that to someone because out of a reflex.
Yes.
But I have never out of a reflex in a medical situation punched someone in the face, kicked them in the face, bitten them, all of those things.
Right.
Nurses get hit and abused all the time.
Unfortunately.
And I'm not saying that every person who's ever hurt a nurse should be put in jail or anything like that. But if you are in your right mind and you purposely are trying to hurt a nurse, because how many patients have gone to jail because they put their hands on a nurse?
That would be an interesting statistic.
It's probably very low. You don't get in trouble for it. I'm sure. So I think if they increase that, the safety of nurses would increase. So I really think that needs to be a huge change in nursing. Like, absolutely, that's what I would fight for.
I will keep that in mind, daughter.
Work on that for me.
I will. I will.
If you need me to sign your petition, I will.
Absolutely.
If you could go back in time and give your baby nurse self a piece of advice, what would that advice be?
To stay calm. Mm-hmm. Because when you get overexcited or you let the anxiety creep in, that's when you make mistakes. I was very fortunate to have a very calm preceptor. And so I learned very early that you can freak out after. And so I would say always keep your cool and get up and go in, even if you're crying. Every day is not the same. And sometimes in your most stressful situations, you walk out feeling like Superman.
Mm-hmm. I like that. If someone were to come to you and say, I'm thinking of becoming a nurse, what would you say? And would you recommend it?
Absolutely. 187,000,000% yes. Become a nurse. You are so valuable. You have the potential to do whatever you want. I mean, that's the flexibility that comes with a nursing career. You can stay home and work on your computer. You can fly in a helicopter and emergency evac someone out. You can do basically anything you want. Who wouldn't want that opportunity and the respect and the pay that comes along with it? I personally think pay should be a little bit higher for nurses, especially what we're responsible for. But I think in due time and process that will occur. If you have the capacity, the patience, the understanding, the empathy, and the smarts, go do it.
I agree. That's the best job ever.
I agree. 100%.
In any capacity. You could literally do anything.
Anything.
All right, guys, that'll be it for today's episode. Thank you guys so much for watching. Before you go, please don't forget to like and
subscribe.
All right, guys. Bye.
Bye.